Hello, I am the orthopedic nurse navigator for joint replacement here at UT Medical Center. Welcome to Total Knee Replacement Discharge class. We will look at information about activity after surgery. Most importantly, make sure you are getting short walks in every hour while you're awake and using your walker every time you get up. Continue range of motion exercises. Be mindful of walking on uneven surfaces and walking over door thresholds. Do not sit in low or soft chairs. Do not resume sexual activity until discussed with your surgeon. When you are going up steps, remember to step up with the good leg first. When going down steps, go down with the surgery leg first, which would be considered the bad leg. Coughing and deep breathing after surgery is important to re-expand lungs and help prevent pneumonia. Take 10 slow, deep breaths and cough once an hour while awake. If there is not any issues with breathing, it is okay to stop using the breathing machine on post-op day 10. Antithrombotic hose or compression stockings should be worn after surgery to help prevent blood clots and swelling. You may remove them for short breaks and then replace them. Please use them for at least 10 days after surgery. Your surgical leg will have some ACE wrap applied over the surgical incision area. Underneath the ACE wrap will be cotton padding. The final layer of surgical dressing is the waterproof dressing covering the surgical incision. You may remove the ACE wrap and cotton padding 2 days after surgery. The waterproof dressing will remain on the incision until your first follow-up appointment with your surgeon. If you have any pin site dressings or drain site dressings, these may also be removed 2 days after surgery. If there is no more drainage coming from the pin site or drain site, it may remain open to air. If drainage continues, put a new dry 4x4 gauze on it and call the surgeon's office to notify them. Next is information about your surgery site and the surgical bandage. The surgical site bandage will be waterproof and it will stay on until the first post-op appointment with your surgeon unless your surgeon instructs otherwise. Always wash your hands before touching the surgical bandage or the area around it. You or your caregiver will need to look at the bandage at least twice a day. If there is drainage touching 3 of the 4 edges, call the surgeon's office to let them know. There may be some spotty drainage on the bandage, and that's okay. If the bandage is saturated, call the surgeon's office and let them know as soon as possible. Do not apply any ointments, lotions, or creams to the surgical incision area. Remember, some swelling and bruising at or near the surgical site is normal and should decrease over the next 2 weeks. Pain after surgery is expected and will likely be worse somewhere around post-op day 2 or 3. The opioid pain pills are prescribed to help control the pain after surgery. Always take the pain medication as prescribed. You may take less than prescribed, and a couple tips would be starting with the lowest dose first or taking half a pill at first rather than a full pill. Another tip for pain management is to use over-the-counter Tylenol or acetaminophen, which is the generic name. You may wish to add the doses of Tylenol with the opioid pain pill, or you may alternate between the doses of the opioid pain pill. Make sure to not exceed more than 1,000 milligrams of Tylenol at a time, and do not take more than 3,000 milligrams total in a 24-hour period. It is helpful to have your caregiver keep a list of medicines, the dosage and time of day you are taking them. This will help you keep track of all your medication and prevent accidentally taking too much. Elevation is important for healing and preventing any further swelling after surgery. You can elevate the surgical leg by propping it up on a pillow or using a leg elevation device. Be sure to elevate your leg for at least 30 minutes at a time, several times a day. You will receive a knee wrap with ice packs. Ice therapy is a valuable tool to reduce pain and swelling after surgery. Ice will constrict blood vessels and help reduce swelling at the surgical site, which in turn helps with pain. The recommendation for ice therapy is 20 minutes on, followed by 20 minutes off. If you have reduced sensation, use extra caution when using the ice packs. You will not be able to drive after surgery. You will need permission from the surgeon to resume driving at the appropriate time. Do not drive while taking prescription pain medicine. These are some of the medications you may be given after surgery. Not every person will receive every medication. Some of them are as needed and some are prescribed by the surgeon. If you have questions about any medications you are given, please ask your nurse or reach out to your surgeon's office. Constipation can be a common occurrence after surgery. There are several things you can do to prevent or treat constipation. Getting up and increasing activity, drinking adequate amounts of water, eating a balanced diet with high fiber foods, and using over-the-counter stool softeners and laxatives will help if you are constipated. Do not let more than 1 to 3 days pass without having a bowel movement after surgery. If you are having difficulty with constipation, please call the surgeon's office for recommendations, or you can reach out to the nurse navigator. Preventing blood clots after surgery is very important. You will be prescribed a blood thinning medication to take after surgery for a specified amount of time by your surgeon. There are several things you can do to help prevent blood clots from forming. First, take your blood thinner medication as prescribed. Then make sure you are getting up and moving. When you are sitting, pump your feet or ankles and stay well hydrated by drinking plenty of fluids that do not contain caffeine. You will want to prevent infection while you are healing from surgery. Always wash or sanitize your hands before touching any area around or near the surgery site. Monitor your surgical site and the skin around it for any signs or symptoms of infection. If there are pets in the home, do not allow them in the bed where you sleep or to lay near the surgical site. If you need a medication refill, call the surgeon's office during business hours. The surgeon's office will need 48 hours to process the request for refill of medication. You can plan to call before you run out of medicine. Please call the surgeon's office if you have any urgent problems. Some reasons you may need to notify the office would be for temp greater than 102 or higher for greater than 24 hours, any infectious drainage from your surgical site, a dramatic increase in redness and warmth around the surgical site, new onset chest congestion, severe calf pain accompanied by increased swelling in legs, pain that is increasing after taking medications, new onset dizziness or confusion, blood in stool or urine, and if you fall or injure the surgical leg. If you have urgent questions that arise that cannot wait until regular office hours, the surgeon's office has an answering service and a provider on call. Be prepared to give your name, date of birth, surgeon's name, and date and location of your surgery. The provider on call will get a notification of your question and will give a call back. If you experience any chest pain, trouble breathing, or shortness of breath, call 911 or go to the nearest emergency room. For a successful recovery from surgery, make sure to keep all follow-up appointments, take medications as prescribed, complete physical therapy program, be active, and eat healthy. Thank you from your healthcare team here at UT Medical Center for allowing us to be a part of your joint replacement journey.